Hello, everyone, and welcome to tonight's webinar. The title of it is Assessing the Impact of Your Handpiece on Air Quality. I'm Dr. Gary Severance with Henry Schein, and it's my privilege to be joined tonight by two experts on the category. Daniel Call will join us in a little bit. He's the Director of Sales of North America from BN Air. And we also have Dr. Jablow. He's America's dental technology coach. He practices in Woodbridge, New Jersey. He has fellowships from the Academy of General Dentistry and the International Academy of Dental Facial Aesthetics, and is a longtime member of the county's peer review committee. So tonight we have essentially all the time zones located. Dr. Jablow is in New Jersey, I'm in Dallas, Texas, and Daniel's out in California. So we have it all covered. So again, welcome. Daniel will be utilizing or presenting this. I just want to make sure all of you have your volume up. Any of the big programs that you have are closed, so we have good connection speed. And Daniel will be presenting or clicking, so I'll say next on the next slide. Daniel, if you can advance, that would be great. So again, welcome everyone. Tonight's webinar, what we're going to do is review a little bit on the aerosol and the handpieces that have been defined in the literature. And as we know, with the whole pandemic that we have, just about daily things change. And there's no clear definition of aerosol and droplets and other things. We can talk about it, but it's always best to be on the safe side of it. So anything we can do to reduce the aerosol production, whether it's speaking loud, whether it's not sneezing in public, whether it's not using handpieces, or better yet, even using judgment and how we use the handpieces can aid that. We'll review the latest guidance, and we seem that we have guidance from all over the place. It's no longer just the ADA. We now have OSHA, obviously, CDC, even the engineers from ASHRAE, the engineering that does refrigeration and airflow in industry. So we have a lot of cooks in the kitchen to give us areas, and it's best to really focus on we know dentistry best and what we can do. We'll talk a little bit about aerosol versus splatter, and then your handpieces, the anti-retraction valve. It's pretty unique. We have Dr. Jablow with us, who is all about dental technology, and normally we don't think of a handpiece of being a piece of technology, but you'll find out it really is. And there's real advantages into knowing what you have and knowing what you can expand on. Sterile irrigation, the cleaning and the reprocessing, or can we really disinfect the inside of our handpieces before we sterilize it? And then we'll turn it over to Daniel on what are the benefits from BN Air, specifically, who is well prepared for this pandemic. Next. We've looked a little bit, and it really becomes, there's a landmark article that the ADA in 2004 defined aerosols and splatters in dentistry. And they reference Mitchik, who in 1996 had some great documentation as well. And they started to design the difference or define the difference between aerosol and splatter. And they talked about the size of the carrier essentially. And then we also know recently it's been promoted and talked about that it's the COVID-19 or the SARS-CoV-2 is transmitted primarily by the aerosol routes. So there are different devices that we use in dentistry, and it's safe to say that in order for us to make money, we have to make aerosol in many cases in dentistry, and that's just the nature of the beast. But I think we've said it through all our webinars that dentistry was the best prepared for this. We've always had PPE, we've expanded it a little bit more, but we've also been very pursuant to taking care of aerosols since the early 80s in what we do in dentistry. So I think this just expands what we're already doing. But it's pretty unique when you start looking at all the different devices that we use. Can we do, or can we be even better and do even better? Next. So it's real important that we look at all of this. And usually, again, aerosol versus splatter, and in between there are droplets category. But aerosol really categorizes anything that's carried in the air. So it doesn't necessarily have to be a size. But we make a distinction based on surgical masks and also respirators that splatter, usually a larger particle, and they say it is more like a ballistic, meaning it goes a little bit but drops fast. Aerosol, which we know can stay in the air up to 3 hours now, we need to move that out if we can. And we do that with air management systems, right? So we can put fans in place, we can look at our HVAC systems and try to get all the aerosol out of the breathing zone and onto surfaces, floors where we can use disinfectants, or we can get it out or recycle or recirculate that air. So that's pretty interesting to look at too. But really what we're most concerned with is aerosols, which can stay airborne. And we create aerosol generating procedures, AGP, every time we pick up an air water syringe, every time we pick up an ultrasonic device, also when we pick up a handpiece. But aerosols are created right now by me talking, by somebody sneezing, by somebody singing. There's studies going on of different languages that create more aerosol. So it is a never-ending situation we have to deal with. So we have aerosols everywhere in our lives. It's just in dentistry, we may create more during different areas. And usually they categorize it on size, but it's not a definitive. Splatter can be greater than 50 microns, aerosol less than 50 microns. What we're most concerned with the COVID-19 or the SARS-CoV-2 are those small aerosol less than 5 microns, which can get into our lungs or get into our bronchial space. Next. And as you can see, we have a lot of, if you'd go ahead, Daniel, that'd be great. We have a lot of organizations that are giving dentists guidance. And whether we like it or not, you know, CDC has been aware since 2003 on the first thing, that dentistry is a profession of aerosols. And so they come out and will try to restrict in non-emergency situations or even emergency situations to reduce the amount of aerosol we produce. So it really talks about 3 things that we know the EPA has defined as well. Source control is number 1, ventilation is number 2, and air purification is number 3. And normally when we talk about these webinars, we talk about source control, which means, and we know this by, we wrote memorization now, use a rubber dam, do pre-microbial rinses if we can, procedural rinses, dry angles, high volume evacuation. Those are the keys we look at. But what we'll learn tonight is you can even go deeper and you can start looking at the instrumentation that you use, significantly the handpieces, and how can we reduce aerosol generation from the handpieces. And again, everybody says source control is the best we can do and is the most effective. So let's not only look at rubber dams, but look at instrumentation that we use as well. Next. And so when we look at this, we talk also about reusing these, and they say if a dental instrument can't be, or a handpiece can't be heat sterilized, it does not have FDA clearance, do not use that device. So it's important that we not only use or limit our aerosol production with the proper use of a handpiece, but then also make sure we can sterilize it in between patients. And that's something I think we've always done, but it's always good to start looking deeper into the materials and technology that you're using in the practice and see, can we do better? Next. And then, you know, very nice is the ADA after CDC, and sometimes all these regulations are a little bit at odds, and we as dental professionals really have to look at our dental boards, state dental boards, because they're the one that give us license and regulate our practice. But the ADA is a governing body or an advice body that's doing a great job here. And they know dentistry a little bit more than maybe the CDC and others. So they have a nice thing of always using professional judgment. We're the dental professionals. And what they say is employ the lowest aerosol generating armamentarium. So that gives us hope rather than saying don't use any aerosol generating procedures. Instead, use professional judgment and always use care of using the lowest aerosol generating armamentarium. So again, that's a better call from the different regulation. And then we also have OSHA. Obviously, as dental professionals, we're not over, you can go to the next, Daniel. we're not just caregivers, which CDC and other things carry, but we're also employers. And OSHA covers that too. And that's very important. As we know, dental hygienists have been labeled the most dangerous job in America now, with the combination of effects. Dental professionals in categories are 4 of the top 5. So OSHA certainly has guidelines for us too as employers. And they say, obviously, if you don't have the right PPE or you don't have the right precautions, don't use dental handpieces. But most of us now, data from HPI Health, the Institute with the ADA says about over 80% now of dental professionals in the US have over a week's supply of N95s and KN95s and face masks and surgical masks. So we're catching up with the PPE. So this allows us now to go to that next category of using aerosol generating procedures. Next. And we also have the American Institute of Dental Public Health, which talks about using air turbine handpieces with a rubber dam and high-speed evacuation. What you'll find is using electric handpieces are even a better step forward. So we can do a lot of things in dentistry in our own offices to limit using the aerosols. And a great document, you can go next, Daniel. A great document was just released by OSAP. OSAP generalizes and tries to combine all the information. DentaQuest, you can go to osap, I think, .org. Sorry for that, not the information, but you can find it very easily on their site. And what they've done is done a very nice checklist on all of this. And as we know, OSHA has categorized dentistry using aerosol generating procedures as a very high risk. But it's also comforting to know that there are categories that are very low risk. Administrative health that don't have patients in a dental office, that don't see the patients, are very low risk. So while we can minimize those healthcare workers or dental healthcare workers that are at high risk, we can also categorize or bring out some of those that are at low risk. So dentistry covers the whole gamut of risk under OSHA categories. And then JADA comes out with information as well, as you know, and gives us some information on this aerosol. You can go ahead, Daniel. With information, and JADA can talk about the water lines as well. So it's very important for us to look further than just the handpiece. We have to look further into our water lines. And many times that you look at it, we see a check valve or anti-retraction valve in our handpieces. Where it is located is very important for you. And we know that if you replace a handpiece or in the next patient simply put on a new handpiece, because of that retraction into the water lines, you can actually have biofilm from the previous patient. So we start looking at this. And as you can see, it's nothing new. 1984 talked about these retraction valves, and we'll get more information on that and what type of technology you can use to be more proficient and more efficient with keeping your patient's face safe. Next one, Daniel. And we can also look at this transmission route. So a lot of data is coming in now, and they talk about not using any handpiece without anti-retraction valves. And so this is certainly from 2020, very recent, and it essentially says don't use any handpiece without the anti-retraction valves, but I think we can take it a step further and only use those handpieces that have the anti-retraction valve in an area where you can sterilize it. And we'll hear about that too. So we can take many steps as dental professionals to make our profession even safer. Next. And so when we get into this, we also look at sterile irrigation when we do a surgical procedure. And there are definitions that you can see here, and this is by CDC, recommending the use of sterile water during these procedures as well. And they're defined with biopsy, periodontal surgery, implant surgery, surgical extractions. And ideally, we should have this surgical water along, or sterile water along with this procedure as well. So there's a whole host, and if we go to the next slide, we can see that we haven't really taken this up as a dental profession. Most are air driven, which can't provide sterile water during its use. Again, a smaller percentage during share of this is electric, which you will find out creates less aerosol, but also can't provide that. And the company that we're talking to you tonight about has some great solutions, being air, which can provide you sterile water. So it's really looking at this in your dental practice and seeing what we can do better. So in general, we look at different areas that we can do air management, and we know in our office. But again, if we go back to it, the number one and most effective area is to do source control. And a handpiece and the use of water, delivery of water, and the delivery of aerosols is based on source control. With that, I'd like to introduce Daniel Call, who will take it from here and give you some solutions and areas that we can really focus on specifically to be in air as well. Daniel?
Hey, Gary, thank you so much for that. What a very comprehensive landscape of all of the infection control guidelines that are out there. So hopefully I can do my part to sort of nestle in the products that we have, which help us take a step further in many of those instances. There's generally the three topics that I'm gonna cover today is the sterile water for dental surgery, the anterior traction valve or cross-contamination, and then aerosol. The first one is the restorative electric handpiece system. That is our Vanguard product, which has the capacity to control a sterile pump. And this will retrofit onto any dental unit in the field and immediately give you a pump that's installed on the delivery unit. And with that pump, you can then run a sterile irrigation pouch with a sterile irrigation line, disposable between patients. And with our system can actually control a surgery motor with a surgery cable that can be disconnected and sterilized. So there are options out there to bring your dental unit as current as possible to infection control standards without having to buy an entirely new dental unit. Okay, so the next device, which I'm going to discuss, is the anterior traction valve. It's sort of a hot button word lately. And anterior traction valve is just a mechanical valve that is a one-way water valve, and it opens when water's flowing through it in one direction out the handpiece to create the spray, and it closes as soon as the user takes the foot off the foot control and prevents that 1 milliliter of fluid from retracting into the non-sterilizable parts of the delivery unit, like the handpiece tubing and the delivery unit head. The critical thing, and this is sort of something, BNR has always, strived to meet the highest standards of infection control. We want to stay we're a principles first company, and we want to have our products follow the principle to the most advanced standards of infection control, regardless of where the recommendations are at. So there's still about most of the handpieces on the market with fixed back ends do not have an anterior traction valve at all. Most of the handpieces that have couplings do have anterior traction valves, and the anterior traction valve is located in that coupling. That coupling is not removed from the handpiece tubing between patients and not sterilized. So what happens is that over time, there's biofilm that collects and gathers on everything that the water contacts. And there's retraction up to this valve, which is like the gate. And any contaminant or pathogen can sort of latch to that, can latch itself to the biofilm. And just running the water in between patients isn't sufficient. The pathogen or contaminant can detach from the biofilm at any given time. So our design has always had the anterior traction valve located in the handpiece. And that means that every time you sterilize a BNR handpiece, you're sterilizing the anterior traction valve, And so any contaminant that is lodged onto the biofilm on that valve is sterilized. So some of the advantages of our air-driven handpieces. Now, contamination is occurring and actually is originating in two places. The first is the water line. So the water that's coming through the handpiece that comes out the ports here, that creates the spray and the aerosol. It's retracting, and you know, any contaminant that's inside or near those ports are retracting back into it. And so there's managing the water line and the contamination that is occurring inside the water line. And the second place that cross-contamination is occurring is actually the air-driven handpiece uses high-speed gas or air to spin a turbine. And unless the head is sealed here, any aerosol that's generated inside the mouth, and you know, any aerosol that's coming from the mouth or the tissue, will actually be sucked inside the burr hole because a vacuum is created. These things are spinning at 410,000 RPM. So there's a vacuum created, and contaminant is sucked in the burr hole and then exhausted back down through the handpiece into the dental handpiece tubing and then into the dental delivery unit. And those parts of the dental delivery unit are not being sterilized or even disinfected. B&Air's second exclusive design is actually an anti-retraction valve in the exhaust of the coupling. So if you're using an air-driven handpiece by B&Air, you actually have two anti-retraction valves. You have one which is preventing the retraction of the irrigation, the water created to, you know, that's used to create the spray. And then you also have protection not only in the form of a sealed head, so anything is prevented from entering inside the head of the handpiece and being exhausted back down. But then you have a third barrier protection, which is another anti-retraction valve in the coupling. With our electric handpieces, so electric handpiece design is inherently superior in the aspect of the contamination of the exhaust, because electric handpieces don't exhaust anything in reverse. So there's no need for a sealed head in an electric handpiece because there's no airflow going in the reverse direction. There's no vacuum created. It's a positive pressure chamber. You know, it's the remaining air that's cooling the motor is exiting the burr hole and the back of the cap. And so there's no need to manage the cross-contamination of aerosol being sucked back in the head of an electric handpiece, but you still have the water spray. So all of our handpieces, B&Air electric handpieces, have the anti-retraction valve again in the handpiece. You know, every other design has the anti-retraction valve in the micromotor, which as standard practice are not being sterilized between patients. So again, you'll have, you know, it's similar to like a Coca-Cola straw. If you put your finger on the top and your finger being the anti-retraction valve, if there's any contaminant inside the straw, you know, the liquid is not static and frozen. It's swirling and swimming around. Bacteria can bloom at a very rapid rate. So it's definitely, you know, climbing and crawling up through the irrigation tube with a handpiece and contacting that anti-retraction valve. So it's very important to have it sterilizable. So now the second topic is aerosol. And what I wanted to do is illustrate a couple design features we have that can help you reduce aerosol. So first, you can see on the left is an air-driven turbine, and that's generating the most aerosol. The aerosol generated by an air-driven turbine is covering 360 degrees. It's going everywhere. It's going forward down into the patient's mouth, and then because the burr is spinning so fast, there's so much turbulence. It's exiting in the rear direction, so the aerosol that's generated by an air-driven handpiece is going in 360 degrees. So just by going from an air-driven handpiece to an electric handpiece, you can see that you've reduced the spectrum of the aerosol that's generated. Air-driven handpieces generate a spray, and it's much more concentrated and focused, and also the burr is spinning at about half the speed. So that turbulence created by the burr is not swirling and swishing a plume of aerosol backward away from the head, out of the patient's mouth. So one of the designs of our spray enables us to actually eliminate the air that's mixed with water. So for those of you who don't have this explanation already, the spray in your dental handpiece is actually water and air combined in your delivery unit. And there's a control on your delivery unit head. It's called chip air. It's not drive air, which spins the turbine, but it's chip air. And if you can eliminate this chip air, you see what happens is that this mist turns into more of a spray. And so then you're getting into what you were describing in the beginning, Gary, of you're getting away from aerosol and more into splatter, right? The droplets are bigger, they carry a larger mass, they're not gonna float in the air for as long. They're ballistic as you described, so the gravity will take control and drop them to the floor. And then, you know, a great thing about electric handpieces is that you can actually control the speed and without losing torque. And so Marty's going to come in a little bit later. He's the master at this, right? So he's been using electric handpieces as long as I've been with the company, 15 years. But what you're able to do by reducing the speed of the procedure is also reduce the amount of water that's required to cool the burr. So, you know, we're not going to claim that you can eliminate water spray and cut teeth, you know, without water, because that would be dangerous. But what you can do is sort of trying to stay in this direction of the reduction of the origination of aerosol. You can, you know, eliminate the spray of the aerosol. You can reduce the speed of the electric handpiece, and then you can reduce the quantity of water that's needed. And this, on the picture on the right-hand side, is our electric handpiece running at full speed with no water. You know, it's not useful in normal restorative terms, but there are some specialties like ortho, for example. Orthodontists are debonding, they're not cutting tooth structure. So they can actually turn the water completely off. And our handpiece is the only air-cooled design. So the other electric handpieces on the market actually require water to maintain acceptable temperatures. Without the water spray, the head of the handpiece will get too hot, potentially become dangerous for the patient. So the last, and I guess this would be the fourth feature or product that we've had forever. I mean, we did not make this after the COVID outbreak hit, but we have the only handpiece maintenance sequence that uses two cans of spray. One is a lubricant and one is actually a cleaner. We had a study done by the University of Vienna. They have a validated lab for infection control studies, and they validated that this spray net kills 99.9% of all pathogens. And so this is the only handpiece maintenance sequence where this cleaner is being applied to the inside of the handpiece pre-sterilization. So as a general practice, all dental offices are wiping the outside of their handpiece down before they put it in the autoclave, but there's nothing being sprayed inside that's a disinfectant of any kind. Usually it's just a lubricant that's inserted inside and sprayed. So BNR, we've always, again, just trying to sort of meet the principle of the highest infection control standard. This has always been our maintenance procedure. It was a little bit cumbersome to explain before, but now in the new world, it's very nice to say that, we're disinfecting not only the external surfaces, but also the internal surfaces before the handpiece goes into sterilization. So ethanol is the known disinfectant that's contained in spray net. And so with that, I'll give a little bit about our company. So BNR is a very specialized and highly focused dental company. Our factory is in the Jura Watch Valley of BNR, Switzerland. There's been 1,000 years of clock and watchmaking tradition there, which means that we have highly specialized mechanics in producing micromechanic rotary instruments. So very miniaturized rotary instruments that are produced by these big CNC machines. All of that technology emanates from Switzerland because the first industry to actually utilize and develop this technology was the watch industry. So, people were making watches by hand, but they became unaffordable. And so the first, the people those companies wanted to automate their processes. So they launched a lot of the most famous mechanic companies that now produce the large CNC machines that are purchased by the entire world. So we make all rotary instruments, dental handpieces. We make turbines, We make electric contra angles and straight handpieces. We have products for oral surgery and implantology. We make some of the best and most sophisticated. Marty will go into this a little bit too. This is the product that he uses on the bottom left here, the iOptima. We make micromotors and motor controllers. We make the only systems that can be integrated into your delivery unit, like I discussed in the beginning. We make some laboratory products, and we make maintenance devices. We have partnered with most of the implant companies. Believe it or not, there are actually more than this that's on here. I mean, it looks like they're everybody, but we partner with the top implant companies. They rely on very stable and very predictable motors to give the best results of their implants. And that will conclude it for me, unless there are questions. Thank you very much. I appreciate the time.
Daniel, thank you so much. And if I can turn it over to the doctor, the real doctor on the call here, Dr. Jablow. We always turn to you for advice on technology. And again, I want to emphasize, we appreciate all your insight, but normally we don't think of our handpiece as technology, but certainly this is. I'll turn it to you, Dr. Jablow.
Thanks, Gary. The whole idea behind all of this technology is really to focus on the patient and the patient experience. And when we do that, safety is just one part of it. And it's one that's usually taken for granted because we just assume what we're doing is safe. And that was something that was really important to me way before COVID. At the beginning, when we had years and years ago in the first electric handpieces, there were issues with them in regards to patient safety. And then as they have evolved, those safety issues have, basically disappeared. And we've moved on to other parts of the patient safety. And with that now, today, obviously, we have COVID and we have to be prepared for that. But the whole idea of having, retraction valves and other things was foreign to me years ago. And then when I was doing my research for electric handpieces, it made sense to me that the thing that I wanted to sterilize was the thing that had the retraction valve in it. And, to me, that's a really important part because we don't want to contaminate patients. And for, all of dentistry and basically for the human being itself, the good thing is we've got good immune systems. So in many cases in the past, where patients were exposed to some type of potential pathogen, your immune system takes care of it. But now, we're focusing even on higher standards. And with that, I think, when we look at things like retraction valves and generating aerosols, there are ways to minimize the exposure to the patient. And that's the critical part to this whole thing, which is how do we minimize that? So the first thing is, the proper tool for the proper job. And that's really, the key to all of dentistry. So with that, I switched over to electric handpieces because I like the torque. I like the fact that they didn't generate as much noise or vibration, which the patient didn't like, or in some cases even interpreted as pain. But I was able to do the procedure faster. Okay. So I became more efficient with it because instead of cutting teeth, we did with air, we basically milled the teeth with an electric motor. So with that, we look at these things and we go, okay, so what I'm doing is reducing the time that I'm in the mouth. And that to me is really, really important because I think, overall, the more time I spend trying to blow air and water in a person's mouth, the greater chance we're going to have, more aerosolization of everything. And we have to worry about that. Beyond that, we also have to sit there and go, okay, what about the water itself? And Daniel didn't even get into this, and if he wants to come back and talk about it, but on these electric handpieces, they're basically the water ports are laser focused with the whole deal of trying to reduce the amount of aerosol. And if you go back, and Dan, if you can go back to that aerosol picture, because I think that shows it really well. When we go back to that aerosol picture, when you look at that one that's going to be on your left with the air turbine, and you can see that the water in the aerosol is in front, it's above, it's basically all around it. Whereas when you put the electric handpiece on it, which is only, again, rotating at 200,000 RPMs, not 400,000 like you would with an air handpiece, notice that it goes forward slightly, it doesn't go up. You know, so I'm trying to keep the aerosol inside the mouth where my assistant's HVE is supposed to be as close as possible to it, which if we look at some of the literature says it may eliminate up to 95% of your aerosol. So I think it's really important to look at that. And then we have to get into cleaning the hand pieces and how your assistants do it. And, you know, they try and do the best job they can, but with that, they're being forced to try and do more with less time now. I mean, we're trying to get, you know, people combined in and out, but we need to be focusing on this. And if they can now, instead of spending more time on hand pieces and more time on room cleanup, because we're going that extra steps to keep the rooms cleaner, they can place these hand pieces once, you know, there's any debris removed into one of these devices, and they can sterilize or help sterilize or disinfect at this point. They're going to disinfect the handpiece. Then when they're removed from these cleaning devices, that's when they go into the sterilizer. So when we look at that, we have to think about, not only do we have to think about the patient and everything else at that point, but we have to think about our workflows and how these things are going to impact our workflow, especially now when we have to take more time to disinfect in the operatory. I'm trying to also save my assistants some time because they don't have to then sit there with a handpiece, run it for 30, 40 seconds to flush it, then put lubricant, not disinfectant, just lubricant in it, and then it goes back. So again, these are different things that we need to be looking at. When it comes to actual patient treatment, then we have to look at speed. And the great thing about an electric handpiece is that I can set a speed to that and have it exactly where I want it. And that's a critical part to this, where if I set that handpiece to 200,000 RPMs and I hit the foot pedal, the most it'll go is 200,000. If I set it to 100,000 or 50 and I call it put the pedal to the metal, that's as fast as it's going to go. So what I have is an ability to reduce the heat on the tooth, and then I can actually then also, you know, adjust my water if I need to. Now, prior to all this, I really didn't think about much of that, where it was just, okay, the water was on or off. But I have gotten to thinking about it now over the last, you know, few months. And then if I can reduce the RPMs in my electric handpiece now, and they'll be certain where it's going to be, I can also reduce some of the water spray. Again, trying to minimize the aerosol that's generated during the procedure. So there's lots of benefits that I can sit here and talk to you about an electric handpiece, and some of them may be critical and some of them may not. I mean, I'm not going this next step of trying to just put, you know, sterile water into a regular operative dentistry field. I mean, that's beyond what, you know, I think I need to do at this point, but we may find in the future that's necessary. And the great thing about the BNR handpiece is it would be simple for me to just retrofit the thing. These things are simple to do. It's not like I need to then go out and buy a completely new system. And one of the other benefits of these handpieces are, one, they're controlled electronically. In this case, I have an iOptima system. It can be controlled with an iPad or an iPod. You'll see that on the lower left. And I can set any procedure to the exact specifications that I want for that procedure. So if I want a slow speed, I can set the exact speed. And like when I prep a tooth, normally, let's say for a crown, I prep it at 200,000 RPMs. But when I go to do my margins, okay, there's a button, you know, I just hit the button on that, and they're not real buttons. They're, you know, they're an iPod. So they're all virtual buttons. I can create as many as I need for whatever I need. I touch that, and now I get 100,000 or 50,000 to fine tune what I'm doing. So with all of that, I got much more control, and the more control I have, the better it is going to be for the patient. So I think those are some of the real benefits of looking at electric handpieces. and why they may benefit you in a clinical sense. The other great thing is, beyond all this aerosol, is that one motor can do endo, implants. You're not running people in and out. That's another thing. Especially now, people aren't supposed to be leaving the treatment room to go get things and all, the things that we need to do now to protect our patients. So the fact that I can do multiple procedures on a patient with the same motor, again, reduces the chance for cross-contamination. And I think that's another piece to that electric puzzle that sometimes isn't, brought up. So I've been using these for a long time in my office. I've been very happy with them. They perform exceedingly well. I'll be honest, if I had to go back to air to prep teeth, I probably wouldn't want to do it anymore because it's just that much more of a hassle. But from a safety perspective, the retraction valve, the anti-retraction valves in the handpiece are really critical. They do get sterilized, and it's just one more thing you can tell a patient about how you're keeping them safe.
Great, Dr. Jablow. Thank you so much. Great insight. And I think we're all pretty impressed as we get into the technology that we use in our dental office. And a lot of the forethought you mentioned right off the bat, that none of this was done because of the SARS-CoV-2 or the COVID. These were all thought well in advance. And we see that on a lot of technology. And we may not appreciate it until we happen to have to use it. So great insight. We've got some great questions too. Some I'll be able to address, I think, and then turn it over to you guys if you still have time. One thing I wanted to address, Dr. Jablow, I think you mentioned iPod a couple times. I haven't heard that word in 10 years or so. So did you mean iPhone?
No, I meant an iPod Touch, Gary.
Okay, wow.
So what it is it's just a controlling device,
Okay.
all right? And it's the least expensive controlling device that you can use that integrates directly onto that,
No, that's wonderful.
the control unit. You can use an iPhone, okay? Occasionally, if I'm really desperate, I can charge from it, okay? So, and, I've even done where I was doing something else on a patient. The patient says, has asked me, can he charge on it? But the other thing that's really cool about it is that a lot of patients ask about it. What's that iPhone doing up there? And I tell them it controls my dental drill. And it's just another piece of high tech in my office that sits there. And again, most patients don't make a comment about it, but there's plenty that do. Yeah. And it gives you the opportunity to discuss, different things. And again, most patients like high tech. I mean, Gary, you've worked in the high tech area with CAD/CAM for a long time. Yeah. And you know how all of that looks when a patient's, when you're scanning them and they're going, oh my God, I can't even believe that. Well, it's the same type of response that you get with that. So no, I did mean an iPod. You can use an old iPhone if you have it. Right. You can use an iPad. As long as you have a lightning connector right now, it'll work. So that's
wonderful. That's great. Thanks for the clarification. A few questions here from Dennis. How long do aerosols from handpieces and ultrasonics stay in the air? The aerosols droplets may be heavier and not stay airborne for a long period. CDC website states that there is no proven disease produced by a dental aerosol. I'll try to address that if that's fine. Yeah, we're not aware of anything. WHO, CDC, we're not aware of any COVID situation that was transmitted in a dental environment, which really, and cross our fingers, knock on wood, do everything. But dentistry has always been real conscious of airborne aerosols and infection control. So I think what it shows is we've been persistent, and there are small things we can do. It also, you asked the question about aerosols, that yes, the larger the particle, the faster it drops. But I would say after everything we hear and learn, the best thing you can do in your office right now is get an HVAC engineer and look at airflow in your office. Where is the air taking these? So we can have these aerosols that stay in the air for up to 3 hours if they're very small. And in dental offices in the past, we knew dental assistants were running around, getting the patient, running to sterilization, doing that. And when you have that type of turbulence, you even create different airflow. So it's real important to look at where your supply is, where your return is for your HVAC system. And that'll give you an idea of where the airflow is going. And if you want to complement it with air purifiers or additional airflows, that will give you a real sense of how can we get that aerosol out of the breathing zone as quickly as possible. So a lot of things we can continue to research, but again, I think it's safe to say dentistry has proven itself to be very safe over the years as well.
Gary, let me follow that up.
Yes, please.
With, you know, one of the things I do tell my patients is that, you know, we've kept them safe for all these years. Now we're just trying to keep them a little bit safer. Yeah. And they see the difference between what we did and what we're doing now. And the other thing too is, and this is the truth, the cleanest place I go is my dental office. All right. It's cleaner than my house. It's cleaner than any hospital I've ever been in. All right. It's cleaner than my physician's office where they, if I'm lucky, they, you know, pull that white piece of paper down. But the, you know, but I've never seen them actually clean anything else in the room. So it is the safest place. And when you talk about the air circulation, I mean, there's a whole lot that goes into that. And I think that one of the things that's easiest to do if everything is, you know, set up even close to being properly is just run the fan.
Yeah.
If you run the fan in the furnace, what you're going to do is circulate air. And that's what you're looking, that's the need here, is to circulate air. So hopefully, you know, that's an easy trick because it's just go to your thermostat and press the button on. And, you know, there's other things. People are fogging with hypochlorous acid and ozone and all these other things. But, you know, keep it simple is the way I like to put it. And I think that, you know, emphasize to your patients that you've kept them safe and they know it. And again, tell them how clean it is. They can see it. Yep. And, you know, just keep doing that and up the game just a little bit.
Yep, good point. And the only thing I would add to that is probably look for any dead zones in your office where the air is not circulating. And if you can get that into the circulation mode, that's probably even better because there are some closets, there are some others. And the CDC mentions not turning off your fan, making sure the bathroom fan is constantly going. So take away all the technology that turns it off if no one's in there. And then we had another good question too, the 15-minute rule that CDC brought that requires you to, or requested that you leave the room. And it wasn't just on aerosol producing procedures, it was every time a patient left. They've retracted that in the most recent CDC guidelines and don't give that anymore. But based upon what procedure you did in the room, you may want to give it, because droplets fall, aerosol stays a little bit, you may want to govern yourself on professional judgment of what procedure was done in the room, of when you can allow your team into that to disinfect and to clean. And then Daniel, something I think that you could take a look at, Ari had some great information. He asked, have you ever tested putting iodine or molecular iodine in the water supply of the handpieces to see if it adversely affects the mechanism of the handpieces? And again, we know some of the pre-procedural rinses, betadine and those types of povidone, iodine have been recommended in oxidize or break down the lipid layer. So he's asking a couple different areas, have we looked at iodine to disinfect or run through the water lines? Does that have any adverse effect on the handpieces themselves?
So we have not tested those materials in our lab. You know, sort of the way that the FDA 510K validation process works is that we must, you know, we must produce and test internally in our lab, and then have separately a third-party test done by, you know, a CE certified lab. And so we, you know, it's a very expensive and long proposition to test with new materials. And for us, frankly, it's sort of irrelevant because I mean, unless the contaminant is coming from your water source, which I don't think that, we're trying to, I don't think the iodine is trying to, correct that. Our anti-retraction valve stops any cross-contamination because it's sterilized. I think that some of the recommendations I've seen for the different elements being added to the water, the idea is that you're generating a disinfecting aerosol, and so we haven't as a company, I think that would be more on the dental unit water, the whichever company, produced that iodine. We typically are not going to have our products tested with a new element, in a third-party lab for something like that. I mean, our stuff is more maintenance related to guarantee the warranty and the functionality of the product. It gives an outline sort of guidance. It's just really nothing corrosive. So no, the answer is no. We haven't looked at that. That's because, from our standpoint, the anti-retraction valve being sterilizable satisfies our infection control, standard.
Okay, good. And then a follow-up to some of the things we talked about, air circulation, two of them in general. I think the CDC or some have said to keep the air circulation on or the fans on almost 24/7, even if you're away. But also there's a question about circulate air from the treatment rooms throughout the office. And essentially, we talk about air changes per hour. How efficient is your airflow? And it's a very good point. We don't want to necessarily circulate the air from the operatory into clean areas or hallways or other things. But that's why every office, in dentistry, it's a good or bad thing. Every office is different. And you have airflow circulation already, but if you find that the airflow either has a dead zone or you're actually flowing the dirty air out into the patient areas or out into the hallways, you may want to look at a separate air purification that may grab that air before it gets out. It's really keep the air moving, keep the out of the bad air, essentially out of the breathing zones, and get them down to surfaces. But yeah, very good point here. We don't want to necessarily bring it out into the common areas. And that's what you'll see with some, the talk of negative pressure rooms where you export the air through HEPA filters to the outside. And just, it got to a point when you go down the rabbit hole on all air purification, you almost come to the conclusion that maybe the safest place for us to do dentistry is outside. But then as Rella Christensen told me, yeah, you just want to understand which way the air is blowing and keep moving your chair around so it blows away from you from that. And for Dr. Jablow, then a follow-up question with, I think, primarily the difference between air-driven and electric-driven. How easy is it to cut endo access through PFMs and zirconia crowns? And do you notice a difference?
Oh, there's a huge difference. When you go to an electric, because of the torque, you're able to cut through a PFM very simply. Zirconia is a little bit different. Obviously, the simplest thing, like if I'm cutting off a zirconia burr, and I know this was about endo access, I actually turn the speed down. I use a fine diamond at 100,000 RPMs, and I usually can cut through a zirconia crown fairly efficiently. Now, I won't say it only takes one burr, okay? But it's not a 20-minute procedure, okay? It's a 5-minute procedure or so. The same thing with endo access. Again, a fine diamond end cutting with at about 100,000 RPMs will cut through it fairly efficiently. So it has to do with torque, and it's kind of counterintuitive to use you think you'd want to use something coarse, but you don't. You really want to use something fine. And so a fine diamond with the increased torque, and then Daniel can answer this, the difference. I think the most torque you're going to see in an air handpiece is about 30 watts. And I'm thinking that mostly electrics are going to be 60 plus. So they're more than they have more than twice the torque. Dan, is that correct?
Yep, up to 100 watts.
Okay. So you could have up to like 3 times the amount of torque, and that torque is what's going to make the difference. To me, it's a simple procedure. It's not what I like to do, but I mean, going through a PFM is very simple with an with an electric handpiece. A little bit more work to go through a zirconia, whether it's for endo access or to cut one off.
And Jenny had an additional question. Does using electric handpiece make cutting more technique sensitive? I know it's essentially the reverse, but what are your thoughts on the technique?
I don't think it's more technique sensitive. I think, there's that very short learning curve. So an example might be is I've changed the way I prep teeth. The same way when I went from air to electric, I changed the way I prep teeth. When I went from to all ceramic crowns, let's say we went to Emax or zirconia, I changed the way I prep teeth. And then when I went to digital impressions, I changed the way I prep teeth. So when we look at all of those factors, there's always that small learning curve. So I think electrics are a small learning curve. I mean, one of the things that I talk about when people ask me about how do I prep it is if I'm going to prep a crown, I pick the right size burr. And people go, what do you mean the right size burr? Well, if I know that the burr, let's say it's I'm going to put a chamfer on it, and it's, the tip is 1.5 millimeters, I know I just have to sink the burr. And so I literally will sink the burr 1.5 millimeters and drag it across, and it just cuts. The same thing if on let's say it's an anterior tooth and I need to cut it down, I don't start grinding at the top. I grind through where I want it to end. So you change how you function with the tools that you have, and the better the tool, the more efficiently you can actually do it. So yes, there's a small learning curve if you want to take it, but it's night and day difference prepping teeth. And again, when you want to finesse something, here's the one I'd always talk about, and everybody laughs. How many people have put a brownie into an air handpiece and revved it up and been shot with what I call a rubber bullet? Okay. Almost every single dentist has done that. Well, if you look on the packaging from Shofu for those brownies and greenies, there's a maximum RPM on it, all right, which is exceedingly below what goes on in a high-speed handpiece. So what you do is you set the thing, and you can have it like on that little iPod, your thing that says brownie, and you press brownie when you do it, and it's never going to exceed that maximum RPM. So when you talk about finessing things, that's finessing things.
That's great. And Ari, I just want to mention, we're going to give this to be an area or suggestion. Daniel will, have it considered as well. So appreciate all that information. Just want to summarize. I want to thank you guys. I think what I've learned here is, an electric handpiece creates less aerosol than an air-driven. Anti-retraction valves are critical in every handpiece that you would use, so check that out. And certainly if it's in an area that you can actually sterilize it, I think it makes sense as well. And then using surgical procedures, use sterile water if possible. And some great ideas here from Ari too that will, and I learned that iPod still exists, so thank you, Dr. Jappo. Any other questions? I think we're good. I want to appreciate we're coming up right on the exact time, so Adam will be very happy with us. Again, I want to thank all of you. If you have any suggestions for future topics, if you have any questions, I'll give Daniel a chance to give his email or where people can go if they have questions on how to experience the Be-in-Air experience.
Yeah, so you can always go to our website, www.beinair.com, and there you can find all the contact information. You can find my email address, which is my name, Daniel. Then there's a period before my last name, Call, which is spelled conventionally C-A-L-L, and that's at beinair.com. Thank you very much, everybody.
Yeah, thank you all. Again, if you have any questions or topics for Henry Schein to deliver to you next time, just email us at webinars@henryschein.com and we'll respond. Thanks for the great questions. Thank you both for the great interaction and the great education. And as we all know, infection control is additive. So You do one thing, it's great. If you do a second or a third, and I think we found some areas in this webinar where we can take action in our own practices. Thank you all.